restriction the big country faces with increased COVID-19 cases is elective surgeries. That can be anything from knee replacements to certain heart surgeries. Marley Capper spoke with a mother of two whose elective surgery has been pushed back as a result of COVID-19.
What was going through your mind?
I don't want to die.
Christy Yeldell has faced various health issues in her life.
Glioblastoma stage 4 brain cancer, they took that, I beat that. Then they found cancer in my bones.
And since has faced another major complication requiring her to get a hysterectomy.
I hurt and I'm bleeding constantly. I'm getting anemic and then I'm weak and then I have kids at home.
And now can't even get the operation she needs since Hendrick pushed back her surgery date due to a lack of ICU beds.
It makes me angry, honestly, because what if it continues to progress and I'm not going to be able to be there for my 5-year-old and my 3-year-old.
And Dr. Tim Martin says that as a physician, it's heartbreaking to tell his patients they can't see the specialists they need.
This pandemic is affecting people in ways that we don't really think about because they're not the ways that affect us.
Which is why Christy says that others need to take it more seriously for people like her.
There are families out there truly trying to live through this and have other underlying conditions, and those are the ones that are dying, and we don't want to be one of those numbers.
And while she was able to get her surgery moved to a hospital in San Angelo, it has presented new challenges for her.
It is a relief, but it's a financial strain of worrying about getting back and forth.
And having to ask her family for money.
For gas. I mean, something that seems simple to everybody else, but it's not.
And until patients like Christy are able to get the care they need, Dr. Martin says to help control the spread.
This is the time to use our freedom to make choices that are good for the population as a whole.
In Abilene, Marley Capper, KRBC, Abilene's local news.
Thank you, Marley. Right now, Christy is watching San Angelo's COVID-19 cases because if they continue to spike, her elective surgery could be pushed back for a second time.
Now, that made us wonder here at KRBC, what exactly was the criteria for an elective surgery? We talked to the chief of staff at Hendrick Health to find out more.
A medical definition elective would include anything from a total joint replacement, a hernia repair, something that at the moment might not be immediately life-threatening, to someone with stable coronary artery disease, blockage that needs a bypass surgery, but would require an ICU stay afterwards.
So people who need these types of surgeries will be unable to get them until the COVID hospitalization rate is below 15% for 7 days, and then ICU beds start opening up. More